future nurses, welcome back to Nursing Guru, where nursing learning becomes simple, smart and full of energy. If you are studying applied anatomy and physiology, this is your moment to get started the right way. Today, we are diving into the first chapter, that is Introduction to Anatomical Terms and Organization of the Human Body. Don't worry, it sounds tough. By the end of the sessions, you will understand it like a pro. I will also share the most important and predicted exam questions so you can study with a focus and confidence. Remember, every great nurse starts with a strong basis, and this is where your journey begins. So grab your notes, stay tuned, and let's learn together with the Nursing Guru, where nursing or future nurses are made. Let's start. So as I mentioned earlier, our first unit, that is Introduction to Anatomical Terms and Organization of the Human Body. So basically from this unit, we can expect some of the question like a short answer or MCQ or very short answer questions. So is there any chance for the essay question? That may be a question from your side, is it? So there is a chance, for example, when we are talking about the epithelial tissues or in the part of tissues, there is a chance of essay question, but usually, normally in every examination, short answers and very short answer questions are asking from the unit 1. In the unit 1, it is talking about the anatomical terminologies that is related with anatomical position, anatomical planes and etc. A lot of things are there. So why these terminologies are important? These terminologies are important not only for your examination, it is very important in our future also. If you are studying second sem, third sem, fourth sem, we have a lot of subjects like medical, surgical, child health, pediatric, psychiatric, lot of subjects are there. Or in the future, when you are learning or when you are working, these terminologies are very important for understanding the exact scenario. So that is the reason this first unit, anatomy first unit, is very important for not only nurses, in every medical professional. So first, that is describing about the anatomical position. From your classroom, maybe you will get the video demonstration or otherwise some models demonstration etc. you maybe get from your teachers. And also I would like to tell you that you should remember about this anatomical position that include anterior, ventral, posterior, dorsal, superior, inferior. What are the next things? Okay, you can comment, or I will also tell that lateral, proximal, distal, superficial, lot of things are there. So you need to understand what you mean by different positions and how you can understand that. Next is about the anatomical planes. When it comes to the planes, different anatomical planes already you may be familiar, that are axial, transverse, horizontal, sagittal, vertical, coronal, frontal and oblique. Maybe you have studied all of the things, and also through the shorts we will demonstrate you. Okay, in this unit, next the portion is anatomical movement. Different anatomical movements are there. Example, abduction, adduction, flexion, extension. So what is that? I will explain. First is about the flexion. So what do you mean by flexion? It means bending a joint or decreasing the angle between two body parts. That is known as flexion. Example, when you bend your elbow to knee, that is flexion. Then what is this extension? Means straightening or joint or increasing the angle between the two body parts. Example, when you straighten your arm or leg after bending it, that is extension. Simply, I will tell that, remember, flexion brings bones closer together and extension moves from apart. Clear? Okay, so next is about abduction and adduction. Do you have any idea about abduction and adduction? Okay, I will tell you. Abduction means moving a body part away from the midline, means an imaginary midline. An imaginary midline is there the movement away from the midline, that is known as abduction. Hope it is clear. Okay, any doubt means you can mention here. Next is adduction, means moving a body part towards the midline of the body. Example, when you bring your arm or leg back towards your body, that is adduction. Is it clear? Okay, so I will tell you a simple tips. Abduction means think, that is away. Adduction means think it is adding back to the body. Hope it is clear. Alright, I think the subduction and adduction, it is clear. Next, I will choose one from here and I will explain about that. Which one? Okay, inversion and eversion. So what is inversion? Any idea? Okay, inversion, that means turning the sole of the foot inward toward the midline of the body. I will give you an example. When you test your foot, so the sole faces your other foot, that is inversion. Eversion, the next one is the eversion. What is that? Eversion means turning the sole of the foot outward, away from the midline of the body. It's clear? I'll give an example. When you test your foot, so the sole faces away from your other foot, that is eversion. So I will give you a small tip to remember. Inversion means inward movement. Clear? Eversion means outward movements. Is it clear? Okay, then move to the next one. I will choose one from here, that is which one? Okay, plantar flexion. What is plantar flexion? That means pointing the toes towards or moving the foot away from the leg. That is plantar flexion. Example, when you press the accelerator on the car or stand on your tiptoes, that is plantar flexion. Dorsal flexion, or otherwise it is known as dorsiflexion, means pointing the toes upward or bringing the foot closer to the leg. Example, when you lift your toes off the ground while keeping your heel down, that is dorsiflexion. I think it is clear. Next is circumduction. What is that? It means moving the limb in a circular motion, that is known as circumduction. Hope it is clear. I will give an example. When you move your arm in the big circle at the shoulder, that is circumduction. Okay, I hope it is clear. Once again, plantar flexion means toes down, dorsiflexion toes up, circumduction circular movement of the limb. Is it clear? Alright, we can move to the next session, that is about the cell structure. So in the first unit, in this area we are learn about basic anatomical terms and anatomical planes, and also it is describe different types of movement. In the next area of this unit is talking about the organization of the human body and the structure of the cell and also the tissues. So here the cell structure, it is very important. So when you are studying for the examination, you should draw the diagram. Structure of the cell you should learn, and also from that mitochondria, that is an important thing. You should learn about mitochondria and also the tissues. Okay, so that is important. Structure of the cell is important, so you should learn how to draw the structure and you should learn to how to label the diagram. Clear? Okay, next is about the tissues. In the tissues area, we are studying about the tissues definition and types of tissues and characteristics of tissues we need to learn, and also classification of the tissues and the location. These are the important things regarding the tissues. So next is we need to learn about the membranes and glands. What is that? Membranes and glands, and the classification and the structure of the membranes and glands also we need to learn from this unit 1 of anatomy. Next is about the description about the cartilage. That is also is included in this unit. What is cartilage? And the describe the types of cartilage. It may be a questions, and you need to identify the major surface and body landmark in each body region, organization of the human body. So when we are talking about this cartilage, we know that 3 different cartilage are there. What are they? First is, I will write here. First is, it is starting from H. What is that? That is hyaline cartilage. Is it? So second type of cartilage, that is fibrocartilage. What is the third one? Third one is elastic cartilage. Okay, so we are talking about the cartilage. You need to learn about hyaline cartilage and fibrocartilage, and also the third one, elastic cartilage. Is it clear? Okay, so next is about the muscles. Muscles. So basically we know that three different muscles are there. Which are the basic classification of muscles that include three. So in that three, the features of these three different muscles is important, and also you should learn how to draw that one. So first muscle, that is skeletal muscle. Next is the smooth muscles, and the third one is cardiac muscles. I will write it here. First is which one? First one is skeletal muscles. Next is second one, that is smooth muscles. And the third one, that is cardiac muscle. Okay, so I will explain about that. First one, that is skeletal muscle. So the skeletal muscle main location, that is attached to the bones, and its control, that is voluntary control, means you can control it. Thus appearance means it is striated, or when you are looking through the microscope, it is striated, and also it is multinucleated. What is the functions? It helps in the body movements, posture, and the heat production. Examples where it is located: in the muscles of the arms or legs, face, etc. That is about the skeletal muscles. Next is about the smooth muscles. The location that found in the walls of the internal organs like stomach or intestine, bladder, and the blood vessels. What about the control? It is involuntary. Definitely it is not possible to control by yourself. The appearance means not striated or the smooth. It is mentioned smooth. In the under a microscope, it is a smooth muscle. Nucleus, a single nucleus per cells. What is the function? It helps the movement of the substance inside the body, like a food through the intestine or the blood through the vessels. Normally the smooth muscle, it is looking like this. One nucleus is there. Okay. Clear? Okay, when about the cardiac muscle? Cardiac muscles, the location that found only in the heart one. The control, definitely that is involuntary. Appearance means it is striated, but it is branched with in different disc, like means it is have a connection between the cells. Nucleus, usually one or more nucleus present in one cell. What is the function? It pumps blood continuously throughout the bodies. Clear? So that is the main function of the cardiac muscle. So here is three different muscles is there. Simply I will tell that skeletal muscle means it is striated and voluntary muscle. Smooth muscles means not striated and it is involuntary. Clear? Next is the cardiac. Cardiac means it is striated and it is branched and also involuntary, and it is present in your or our heart only. Is clear? Okay, all right. So these are the things basically present in the first unit. Okay, so in the first units, I hope we will get questions like short notes and very short answers or multiple choice questions. Already I talk about that, is it? So what are the questions we can expect from this area? Okay, so here the important things are tissues. Okay, epithelial tissues you should remember in this session. So next about the structure of the cell. Okay, so and we discuss about the anatomical planes and anatomical position, is it? Yes, anatomical planes and positions, movements we are discussed, and you should read each and everything and understand what these mean. Means axial planes means what? You should understand that one. Then only you can write in a 1 mark questions. Okay, within one sentence you can finish that one. Anatomical positions are important. So these many things are important and we can expect some of the questions from introduction to anatomical terms and organization of the human body. Clear? So this is regarding your first unit. I hope it is clear. Maybe you have some of the doubts. Okay, regarding the terminology, any doubts you have means you can directly go through the Nursing Guru application. The picture and the demonstration it is available. You can use that one. And again, if you have any doubt means don't forget to contact us. All right. Okay, I hope it is clear. All right, future nurses, that is all about today's class. We are discussed about introduction to anatomical terms and organization of the human body. If you have any suggestions or doubt, feel free to DM us on Instagram or comment below in this YouTube. We are always here to help you and guide you. Remember, success in nursing doesn't come overnight. It built day by day with dedication and hard work. So, keep learning, keep growing and keep shining with Nursing Guru. See you on next class. Bye.